To help us unpack some of the policy changes facing gig workers during this enrollment season, we have Natasha Murphy. She's the Director of Health Policy for the left-leaning Center for American Progress Policy Institute. Thanks for being here this morning, Natasha. And this year's open enrollment comes with what you've called closed doors for many Americans. So can you explain what you mean by that and why 2026 seems to be shaping up to be such a turning point for coverage affordability?
Absolutely, Holly, and thank you so much for having me. As you mentioned, the open enrollment period for ACA coverage began on November 1st. And in a recent report, I did describe it as open enrollment closed doors, because this year there are significant affordability challenges that millions of Americans are facing when they log on to healthcare.gov or their state-based marketplace. With the expiration of the enhanced premium tax credits slated for the end of this year, we have so many Americans who are seeing their premium costs skyrocket. And there is significant concern that as a part of a broader affordability crisis, so many are going to be able to not be able to afford their monthly coverage, and as a result, go uninsured. And so there's a particular concern that that is going to have a disproportionate impact on younger Americans, particularly those who are self-employed, the gig workers that were in the earlier segment.
So can you give us an example of how costs might change? So for instance, what might a family or single worker who paid $0 in premiums this year be looking at in 2026?
Yes. So, an individual, let's take a young adult living in a area like Miami. So someone who is 27 years old, so they just rolled off of, their parents' insurance and are on the marketplace. If they're living in Miami and they're earning about $25,000, their premiums last year might have been around $256. This year, we're looking at over $5,000. And as you can imagine, an early career professional, someone who does not have a lot of resources, unfortunately, is not going to be able to absorb that type of premium increase. And there's the concern that they are just going to drop coverage. But as we all know, just because you lose health insurance coverage doesn't mean that your healthcare needs stop. And so there's definitely significant concern about what this is going to mean for the overall health of Americans in 2026 and beyond.
And we know the gig economy, look, it's not going away. So what kind of policy shifts at the federal or even at the state level could actually protect this fast-growing workforce?
Yes, like you said, the portion of the American workforce that are self-employed, that are freelancers, gig workers, is only increasing. And it is so important for our elected officials to support this increasing segment of the workforce. So at the federal level, it is imperative for Congress to extend the enhanced premium tax credits. They truly are a lifeline for more than 20 million Americans, many of whom are self-employed, to continue to have access to affordable and comprehensive coverage. In addition to that, in states that have not adopted the ACA's Medicaid expansion, that's another opportunity to provide a coverage pathway for individuals who are lower income or, may not have employer-sponsored insurance.
So, a lot of people later in life, maybe retirees or people who are just finishing out their careers, maybe doing gig economy, driving an Uber, driving DoorDash, something like this. But it seems like the younger generation, this is their main focus, where, many of us have gone into jobs where you go to an office every day. This is the new trend. So do you feel like the healthcare is going to have to shift overall to meet where the economy's at and meet, where jobs are these days and what people are doing?
Yes, increasingly, I feel like post-ACA, we started to see less of the job lock, where folks were really staying employed in opportunities that they may not have enjoyed or loved for the sheer purpose of having health insurance, because that was the primary means for folks to have coverage. But increasingly, we are seeing individuals start their own businesses, become freelancers, participate in the gig economy, and it is going to be imperative that there be affordable and comprehensive options for coverage for this growing portion of the population.
A concern, you know, as we see younger people getting into a gig economy because that's what they know, that's what they're used to. This seems to be more of a tract for them, that if they can't afford health care, they will drop out of the healthcare industry and just say, look, I'm going to go without coverage. What does that do then to the costs for the rest of the country overall when you don't have those healthy young Americans paying into a system where maybe some older Americans might need the funds that they pay into?
Yes, Holly. So what you're describing are with the loss of younger, expectedly healthier people, it does have an impact on the broader risk pool that the insurance industry abides by and really hinges on. And so the loss of these individuals who are healthier and therefore spend less on average every year means that over time, healthcare premiums and overall healthcare costs are going to rise for the remainder of people who are still in that health risk pool. And so the loss of younger adults and the impact of those coverage losses is going to have ripple impacts across, the broader healthcare system.
So, Natasha, could you give some advice to some, gig workers who are thinking about their health care coverage at this point? What would you tell them?
Absolutely. With open enrollment now underway, I certainly echo the previous calls that it is going to be so important for individuals to actively plan shop. This is the year for you to log on to healthcare.gov or your state-based marketplace and actively review your options. Take a look and see what might still be available and affordable based on your budget, because it truly is imperative to have health insurance moving forward for 2026 and beyond.
Natasha Murphy from the Center for American Progress. Natasha, thank you so much for joining us. Great information there that's so valuable. We appreciate it.